right, so Rickey Smiley Morning Show. We happy to have Dr. MJ Collier this morning. Dr. Collier, always good to have you, and people are always looking forward to Wellness Wednesday. How you feeling, man?
Hey, I'm feeling great, Rickey Smiley, and good morning to you. There's a lot going on. Gary with the team, Maria Moore, and Debrat. So, Rickey, thank you once again for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, this is Mental Health Awareness Week, and we're speaking about mental health in young people and how the internet and social media are influencing and impacting mental health. We are well aware that the need for mental health services has increased dramatically over the past few years, particularly since the pandemic. A CDC study noted that 41% of people experience at least one mental health concern, such as anxiety, depression, or grief reaction. However, more and more teens are self-diagnosing and proclaiming disorders that may not be accurate. Often, young people turn to the internet and social media influencers who will explain their feelings and often, quote, diagnose them, unquote. It's critical, Rickey, and you know this, that the source of information that patients are receiving and believing about a perceived mental health disorder are from a trained professional, a licensed mental health professional. We are already aware of patients who are self-diagnosing. They go through things like WebMD for their physical health. But younger people, in particular this new generation, is turning to influencers on YouTube, TikTok, and Instagram for diagnosis, direction, and advice. TikTok in particular, with 40% of users between the age of 16 and 24, has become a big platform for sharing public health information. Many young people are looking to unqualified voices on social media for their psychiatric and psychological aid. They're seeking solutions with online illustrations that adolescents, we know that they're taking the first step because they recognize they need help, but we just want to make sure that they're getting it from licensed professionals, and that can be very beneficial for psychotherapy and psychiatric assistance. Unqualified social media influencers and those that are posing as therapists often dispense information that is either hearsay or from their personal experience. Their hashtag could be their degree, not a degree. This allows for unchecked spread of information with no filter. And so people are being told that the diagnosis is inappropriate. People don't believe in their diagnosis. Don't take your medications, or your medications may cause side effects that are not there. Non-qualified influencers are not able to identify properly or diagnose or handle a patient's emotional crisis. The terms depression, bipolar, anxiety, and OCD are often mentioned in social media, and we created a generation of self-diagnosing adolescents. So we want to make sure that young people are going to a licensed clinical therapist and getting good help when they need it. They recognize, once again, that they're looking for help on the internet. They obviously are in crisis or know that they have some mental health challenges or problems, but we want to make sure that they're seeking the right sources.
All right, John, with Dr. Collier, good morning.
What are the benefits of black seed oil, and how does black seed oil counteract with amlodipine?
Okay, there's no interaction with black seed oil and amlodipine, which is one of the number one most prescribed medications to control blood pressure, particularly in African Americans. It's called a calcium channel blocker, and it works by dilating your blood vessels and lowering your blood pressure. So no contraindication there. Black seed oil has many benefits. It's a natural anti-inflammatory in most disease states like hypertension or inflammation-based. So are high cholesterol, so are diabetes. It also offers other benefits in reference to joints discomfort. But we found that mental health-wise, a lot of people are complaining about, problems with short-term memory or decreased attention spans, etc. And so black seed oil have even been found to help with those situations. So it is a supplement that I recommend, and it is perfectly okay to take with amlodipine.
All right, John, Dr. Collier, good morning.
My name is Bruce, and I'm trying to figure out, I've been fasting for about a week, and my cholesterol, I just had a checkup and my cholesterol went up. Is that normal?
Yes, because when you're fasting, your body is not getting any fuel. That fuel is stored in your liver as a component called glycogen that is converted by a process called glucose neogenesis, or the creation of glucose into sugar, so your body will have some fuel. It also will cause your liver to release cholesterol. So fasting is not a good thing. I do recommend intermittent fasting, which is eating every meal that you're going to have within an 8-hour period during the day. But just fasting and drinking some of these solutions with cayenne pepper and all of that and not eating any food, can result in what you're describing. And what happens is those levels can shoot up and cause an acute event like a heart attack or a stroke. So you're a clear demonstration that fasting in that way can negatively impact your lab values. A lot of people, when they know they're going to the doctor, they try to clean themselves up, so to speak. So they starve themselves to get their cholesterol down and their blood sugar down, and inadvertently they can make those things go up as a reaction to not eating.
Oh, man, we got another call, Dave? All right, you're on, Dr. Colley. Good morning.
Hey, this is Mina Williams calling from Dallas, Texas. I want to know, Dr. Collier, like a woman in her mid-30s, what stimulates PCOS? Because I'm experiencing PCOS right now, and I need to know, like, what do I do to slow it down? Is there any over-the-counter medication, or is it just specifically related to diet?
Okay, PCOS, or polycystic ovary syndrome, is a condition that affects women. It causes weight gain, particularly in the abdomen. It causes hirsutism, so you start to get hair growing all over your body, particularly on your face. You'll get a mustache, sometimes even a beard, and that it negatively impacts your blood sugar levels as well. Amazingly enough, the number one treatment for that is a diabetes medication called metformin, which you can take regardless of whether you have diabetes or not. It will help control the PCOS symptoms, but also some of the GLP-1 injections like Ozempic and Mounjaro will have benefit from that as well. So they'll make you lose weight, but they'll also help control the PCOS. It's not diet-related substantively or significantly, so I don't want you to think it's something that you eat that's causing this. This is a hormonal imbalance that between your ovaries and your female hormones that causes that problem. And it's usually associated with cysts on the ovaries, which is why they call that. It can cause abnormal and irregular menstrual cycles as well and create problems getting pregnant. So you want to make sure that you're controlling that. A simple solution, a low dose of metformin on a daily basis will correct all of those things. Or if you need to lose weight, look at one of those GLP-1 inhibitors like Ozempic or Mounjaro.
All right, Dr. Colley, let everybody know how you can be reached.
Rickey, I can be reached on all social media at AskDrMJ, Ask Dr. MJ. Subscribe to my YouTube channel for videos on various healthcare topics. Go to my website, lipodrops.com, where you'll find information on supplements that you can keep you healthy and boost your immune system and help you lose weight. Tonight, 6:30 p.m. Eastern Standard Time on YouTube, live presentation, Ask Dr. MJ, where you can ask your healthcare questions. Ask me anything. It's live and interactive where you can get your healthcare information. Go to lipodrops.com, and the link will instantly put you in the program, or Ask Dr. MJ, AskDrMJ on YouTube. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, Black Tony, or the Rickey Smiley Morning Show cast or crew and its production crew.